The patient came to us with a chin fracture of the lower jaw and fracture and displacement of the temporomandibular joint. Was pressed the mandibular nerve. You can see the places of the fracture in the video frame. We then planned the correct situational approach and solution. Chin fixation of the lower jaw with an individualized titanium plate and complete prosthesis of the temporomandibular joint. We received the FreeDM model version, explained the advantages, disadvantages, all risks and complications to the patient and planned the operation. The surgery went as planned. In the picture, you will already see the result of the computed tomography after the operation. As we planned, we installed it with the same precision. The masticatory function was restored, and the movements of the joint are not limited. In short, according to the FreeDM model, we got the same result that we planned.